Question number 8, Dr. Paul Hutchison.
Tēnā koe, Mr Speaker.
Tēnā koe.
My question is to the Associate Minister of Health and reads, what investment has this government made to improve eating disorders services?
Mr Speaker.
Honourable Todd McLeay.
Tēnā koe, Mr Speaker. I'm pleased to report that in 2012, 920 people were seen by specialists.
Order. Would the Minister please start his answer again?
Thank you, Mr Speaker. I'm pleased to report that in 2012, 920 people were seen by specialist eating disorders teams in New Zealand, compared with only 483 in 2008, 1 year before this government's extra funding began. The improved services began in 2009 after this government invested an extra $26 million for eating disorders, which is paying for crucially earlier detection and family-based therapy for sufferers of eating disorders. The situation this government inherited, Mr Speaker, meant that many anorexics in New Zealand would quite likely have ended up having to be sent to Sydney for treatment because services were inadequate here.
Supplementary question, Dr. Paul Hutchison.
What progress has been made as a result of this extra funding?
Honourable Todd McLeay.
Important progress. The extra funding has more than doubled the number of dedicated beds and doubled the number of patients accessing specialist care. There are now 27 dedicated national beds around New Zealand. We're also ensuring community teams around the country are working better together and have stronger links to resources, training and support from their specialist services in Auckland, Wellington and Christchurch. Mr Speaker, anorexia is a terrifying illness. It has the highest mortality rate of any mental illness, but I'm advised that this improved treatment is making a significant difference to the many young sufferers and their families.
Question number 9, the Honourable Leanne Dalzell.
Mr Speaker, my question is to the Minister for Building and Construction and asks, when was the Ministry of Business, Innovation and Employment first made aware